Good morning or afternoon, depending on where you are tuning in from. I'm Bonnie Madura, Senior Program Manager here at the California Endowment, and I'll be moderating today's webinar, Understanding State and Federal Impacts on Health in California. Thank you all for joining us. Policy Perspectives is a virtual space where we gather with partners and stakeholders for conversations on state and federal issues that impact our states and communities. These webinars are nonpartisan, non-political, and non-lobbying, and they are intended to be informational sessions. I have a few housekeeping items before we get started. First, this webinar is being recorded, and the recording and any slides presented today will be shared with all registrants after the event. Second, we encourage you all to engage in the conversation and submit any questions you may have using the Q&A box at the bottom of your screen. We'll do our best to answer as many of these questions during the audience Q&A portion of the program. We also want to thank those of you who took the time to submit questions in advance as they helped us shape today's program. Lastly, a quick overview of today's agenda. We will have welcoming and framing remarks from our CEO. Then we will move into a panel conversation with a stellar lineup of speakers. Then we may be joined by a surprise guest from the Office of Governor Gavin Newsom. And finally, we'll conclude the webinar with time for Q&A after all of the presentations. With that, I'm delighted to introduce our President and CEO of the California Endowment, Brenda Solorzano, to make welcoming remarks and frame the conversation for us today. Brenda, welcome. Thank you for joining us.
Thank you, Bonnie, and thank you everyone for joining us in this very timely moment to have the conversation about what is happening at the federal and state level. I'm honored to welcome you all to today's webinar, and I am looking forward to hearing from our guest speakers. As a statewide foundation with a mission to expand access to affordable quality health care for all Californians, the California Endowment has been proud of what our state has accomplished over the past decade to not only move us closer to universal healthcare access, but also to transform our health systems to address health-related social needs. Unfortunately, that great progress is currently under risk on various fronts. Policy conversations and decisions are happening in DC, literally as we speak, that would make changes and cut funding for the Medicaid program. These actions will have significant and direct impacts on our state, the safety net, our communities, and lives of millions of Californians that are protected by Medi-Cal, California's version of the Medicaid program. Medi-Cal covers 1 in 3 Californians, half of all children, and 40% of all births in the state. These are not just numbers. They are real people, family, friends, and members of our communities. And the impacts go beyond access to healthcare. Cuts to Medi-Cal will also be hurtful to our economy in California. It could mean less resources flowing into our communities and lost jobs. Our partners at the UCB Labor Center estimate that the proposed cuts could result in up to 217,000 lost jobs here in California. In many rural areas, hospitals are the primary source of care, and many of these hospitals may not be able to keep their doors open if Medicaid is cut. At the same time, state leaders are considering budget proposals that would have an impact on access to health care, particularly for our undocumented community. The stakes of these budget and policy debates are extremely high for the communities that we serve. For this reason, our board approved increased spending of up to 10% for the next 3 years. We believe this is a moment that calls on all of us to assess how we are showing up for our communities and to protect the important gains that we have made. We are grateful to the speakers and the partners for joining us today for this important and timely conversation. They will share the latest and will help us understand what is happening in DC and in Sacramento, the implications for our state and the communities, and what lies ahead. Thanks for being here today. But more importantly, thank you for the work you do every day to advance health justice in California. I'm now going to turn it back over to Bonnie to get the conversation started.
Great. Thank you, Brenda, for joining us today and for framing the conversation. I'm now thrilled to introduce our speakers and partners. It is an amazing lineup of leaders, and while I will not go into their bios, we will be sharing full bios in the post-webinar resources. I'm first going to welcome Anthony Wright, who is the Executive Director of Families USA. Families USA is a national nonpartisan advocacy organization uplifting the voices of consumers, patients, and the public to improve health and our health system. Anthony was formerly the Executive Director of Health Access here in California, and he is joining us from DC and will share the latest from Capitol Hill. Then I'd also like to introduce, Anthony, you can join us on screen, Adriana Ramos Yamamoto, Senior Policy Analyst with the California Budget and Policy Center. California Budget and Policy Center is our go-to partner that helps us all understand the budget proposals and their impact on our communities. Adriana's work at the center focuses on healthcare, behavioral health, and social determinants of health. Thank you for being here, Adriana. And last but not least, Amanda McAllister Wallner, the newly appointed Executive Director of Health Access California, a statewide organization working towards affordable, equitable, and quality health care for all Californians. Although she was recently appointed as the Executive Director, Amanda has been at Health Access since 2016 and served as the Director of the California LGBTQ Health and Human Services Network. We are glad you can join us, Amanda. Each speaker will make opening comments, and then we will turn it to a panel discussion with all of the speakers. So with that, I'm going to turn it over to Anthony. There you are, Anthony. Great. Who's going to give us a federal perspective on what's happening literally right now in this moment on the reconciliation process and other federal actions that are impacting health. So Anthony, take it away.
Thank you so much, Bonnie, and thank you to the California Endowment for hosting us here and for the great support of the endowment in this moment and for so many years, both for the work of the health advocacy community and supporting the work of the health advocacy community in California and its national partners, of which I'm happy to be one now as the Executive Director of Families USA, the longtime healthcare consumer advocacy organization here in Washington, D.C. Great to be with many of my California colleagues who I still consider myself one, even though I'm now in a new role, and obviously at a very pernicious time. As we speak, the House Rules Committee is considering a budget bill that would have dramatic impacts on Americans' coverage, their costs, their care, and for specific communities. And I'll get into each of those in a second as I go through the policy, but I just want to say a moment about the process. They are trying to rush this bill. This bill was just introduced a week and a half ago on a Sunday night, the Sunday evening of Mother's Day, a Mother's Day massacre of Medicaid. And they heard it for the first time in a markup in Energy and Commerce Committee in a discussion that started at 1 a.m. Wednesday morning. They heard it in House Budget Committee at 10 p.m. this past Sunday evening. And then this Rules Committee that has been going on for now about 12 hours started at 1 a.m. this morning. I was there at the Energy and Commerce Committee, at the Budget Committee, at the Rules Committee, and they are trying to do this at night because they are not necessarily proud of the product. They understand that as people appreciate the impacts of this budget, that it will more and more people will be opposed and more people will object, and it could stall. And so they're trying to move it quickly. And in fact, they're trying to move it so quickly that even though we do not have a final text, what is called a manager's amendment of the final amendments, they are trying to see if they can get a vote in the House floor this evening, as in tonight. So this is late breaking news. I don't have slides because this is all moving very quickly. So let me go into what the bill does. I think it is, first of all, the biggest cut in the history of the Medicaid program in the history of the country. It is almost $800 billion of cuts to the Medicaid program, which covers, as nearly 15 million Californians, nearly 80 million Americans, including nearly half of children and births, 2/3 of nursing home residents, and so many more. It is just first and foremost a massive cut, the most massive cut in Medicaid in history. But it also cuts Medicare. It also cuts the marketplaces set up by the Affordable Care Act, and I'll get to that in a second. In terms of impacts, while we do not have, they're rushing so much that we do not have a full, complete analysis that normally comes from the nonpartisan Congressional Budget Office. We understand that if this bill were to put in place, we would have at least 14 million more Americans uninsured over the course of the next decade, as a result of some of the policies taken and some of the policies not taken as a result of this bill. About 8-9 million people would lose Medicaid coverage. About 4 or 5 million would lose coverage through the ACA marketplaces, and that would basically erase around half of the gains that we have made as a nation in the last 15 years since the Affordable Care Act, the coverage gains that we've had. That means literally millions and millions of people uninsured, living sicker, dying younger, one emergency away from financial ruin. We have so that's with regard to coverage. Most of this coverage losses is done through bureaucratic barriers. So on the Medicaid side, having people have to reapply not once, but twice a year, having people have to go through paperwork requirements to prove they're working. So it would act both as a job loss penalty. If you lose your job, you also lose your health care, but also that if you are working, but get lost in the paperwork, you fall off coverage. On the Covered California healthcare.gov side, it would also make it get rid of automatic renewal, automatic enrollment, and just put people through a lot more paperwork barriers. That would mean a lot more people would fall off coverage as well. So that's coverage impacts. Cost impacts, it would impose a new copay for those just over the poverty level in Medicaid, to up to $35 for copays for people who are literally making $20,000 a year. That's a real barrier to care, a sick tax, if you will. It is, and then changes in the ACA marketplaces would also both increase premiums and increase cost sharing as well. And then finally, care. That a lot of these cuts are just basically direct cuts to the state Medicaid programs, and including, and maybe in some ways, especially California, in terms of the ways that California and other states fund the program. And that means that the state then would be on the hook to have to figure out how to effectuate those cuts in terms of cutting coverage or benefits or provider rates or otherwise other forms of access to care. So that's it fundamentally cuts billions of dollars out of the healthcare system that we all rely on, whether it be hospitals, whether it be clinics, whether it be nursing homes. And and so those institutions would have to either scale back services, and in some cases, those who are financially distressed, like rural hospitals, maternity wards, might even have to close. And then the final thing I'll just simply say is the attack on specific communities. There's a lot of red meat in this very partisan bill. They're trying to pass this with only Republican votes. And so there's the defunding of Planned Parenthood. There's an attack on gender affirming and a ban in Medicaid of certain types of gender affirming care. There's a specific attack on a state like California that decides to use its own money to provide health coverage to immigrants, whether both undocumented and legally residing immigrants. That would also mean additional billions of dollars cut to California and other states who do that. So that is actually a great example of how you have these specific provisions that may attack one community, whether it be women and their reproductive health, whether it be LGBTQ folks, or whether it be immigrants, but the cut actually ends up hurting everybody, including the healthcare system we all rely on. The cut actually, like that last cut I talked about, doesn't actually impact immigrants. What it does is it cuts billions of dollars from the budget of California that then has an impact on Californians, regardless of their citizenship, regardless of who they voted for, regardless of their district, because we all go to the same hospitals, the same clinics, the same healthcare system. So that's what's at stake right now. It's literally going through the Congress as we speak, but Californians' voices are important. Our representatives are important. There is another stage where it does need to go to the Senate after this, but this will set the stage and the frame for how this is talked about. So happy to talk about more in the context, but I know my colleagues that I'm proud to work with for many years will talk about the specific California impacts. Thank you so much for having me, and I look forward to your questions.
Thanks, Anthony. Next, I'll turn it to Adriana. Adriana, I'll invite you to join me and really bring us up to speed on some key elements of the May revise that was recently released, how policymakers are responding, so far, and what considerations are there to protect the safety net, what opportunities may be on the horizon. So I will turn it over to you.
Thank you, Bonnie, and thank you for the California Endowment for having me join you all today for this important discussion. As Bonnie said, I'm going to focus on our state budget, taking a look at the governor's May revise, which was released just last week, as well as the proposed federal cuts to Medicaid that Anthony was just talking about and implications for our state. Moving on to the next slide. First, I want to acknowledge that the state budget isn't just about dollars and cents. It is a statement of our values and priorities as Californians, and every budget choice shapes the kind of California that we want to live in. So now that we've grounded ourselves a little bit, let's go ahead and review the 3 goals for my presentation today. So first, I'm going to share some key takeaways on the governor's revised 2025-26 state budget. Then I'll review the governor's health proposals, talking about the proposed cuts to Medi-Cal and some changes to the MCO tax and what's happening with behavioral health programs. And lastly, I'm going to discuss federal level threats to Medicaid and implications for California. So starting with the high level takeaways, and I'm going to move through these slides pretty quickly because I want to make sure that there's enough, ample time for Q&A, but you all will have access to these slides after the presentation. So the May revise proposes nearly $12 billion in budget actions to close an estimated $7.5 billion deficit and build up the state's discretionary reserve. It also reflects increased uncertainty as a result of federal policy changes that are destabilizing economic conditions. And the revised spending plan, which is about $226.4 billion general fund dollars, would protect some investments that have been made in previous years, but notably proposes $5 billion in harmful cuts, primarily to Medi-Cal. I'm going to talk a little bit more about that in a moment. Also, I want to mention that the governor doesn't put an end to wasteful tax breaks. California spends billions of dollars each year on tax breaks that largely benefit the wealthy and corporations, and ending these breaks could help to free up some resources to invest in all Californians. So moving on to the next slide, the governor's revised budget includes deep cuts to Medi-Cal that would harm the state's most vulnerable communities. I'm going to talk about these in 4 categories, starting with undocumented Californians, access to Medi-Cal services, access to pharmacy benefits, and then lastly, touch on the impact to healthcare providers. So moving on to the next slide, thank you. The May revise proposes a Medi-Cal enrollment freeze beginning in January 2026 for income-eligible undocumented adults. So that those folks who aren't enrolled by that date would be barred from entering the program. It would also block re-enrollment for those who lose coverage, even temporarily, due to changes in income, paperwork issues, or any life circumstances, which is so harmful. It also proposes a $100 monthly Medi-Cal premium starting January 2027. Undocumented adults would be required to pay $100 per month to keep their Medi-Cal coverage. This would make coverage really unaffordable and could lead to disenrollment. It also proposes to eliminate long-term care benefits for undocumented adults, which would take away access to services that allow people with serious medical needs to live safely and with dignity. It also proposes an elimination of full scope dental coverage, which could reduce access to basic health services and could lead to serious untreated dental conditions. There's also a proposal to eliminate in-home supportive services, or IHSS, for undocumented adults, not for all ages, so apologies for the error. This is for undocumented adults. These services are so important because they help Californians who are blind or disabled and seniors live with dignity in their own homes. And lastly, I want to mention that the proposal it includes a proposal to reduce funding for FQHCs and rural health clinics. So clinics serving undocumented populations would no longer receive an enhanced reimbursement rate for care, which would strain the financial viability of safety net providers. I also want to talk about the cuts that would impact all Medi-Cal enrollees. So starting with the reinstatement of the Medi-Cal asset limit test, which was only just recently eliminated, so it's coming back. This is a test that really weakens a household's financial stability and discourages savings, as people may be compelled to spend down in order to qualify for Medi-Cal services, especially for seniors and people with disabilities. There are additional cuts to IHSS, which, as we noted earlier, help people live with dignity and in their own homes, as well as a proposal to end acupuncture as a covered Medi-Cal benefit. And this is a service that many people rely on to manage pain and other chronic conditions. Moving on to pharmacy benefits, I want to quickly mention that the May revise proposes to end coverage for GLP-1 drugs like Ozempic and Wegovy. It also proposes to add step therapy requirements, which would require Medi-Cal members to try less expensive medications before accessing more costly treatment, which could lead to less timely and clinically appropriate care. It also proposes to require prior authorization to continue some medications, as well as expand drug utilization management rules, which could also delay treatment and increase administrative burden for providers and patients. And lastly, eliminate over-the-counter drug coverage, which could burden low-income individuals with additional out-of-pocket costs for managing everyday health needs. I also want to briefly mention that there are also some cuts to healthcare providers that threaten the stability of our healthcare system. We know that California is already facing a healthcare workforce crisis, and cutting these investments will only make it harder for people to get the care that they need. And if we go to the next slide, before I move on to federal threats to healthcare, I want to very briefly mention some updates related to the MCO tax and behavioral health. So moving on to the next slide. The May revise also makes some changes to how MCO tax dollars are spent. The main takeaway here is that they're planning to spend a little bit more MCO tax revenue in this current fiscal year to offset general fund spending on Medi-Cal, and then a little bit less in 2025-26 and 2026-27. And while there are many cuts to Medi-Cal, next slide, the May revise maintains funding for behavioral health initiatives like BH Connect, the Children and Youth Behavioral Health Initiative, and Prop 1 implementation. And moving on to the last part of my presentation, I do want to talk a little bit more about the federal threats and implications for California. As Anthony mentioned, Republicans in Congress are advancing a budget proposal that would make really deep and harmful cuts to Medicaid. And a memo that the governor's administration circulated yesterday shows that the proposal could take Medi-Cal coverage away from at least 3.4 million Californians and cost the state over $30 billion in lost federal funding. And so Anthony touched on the proposals here, so I won't go over them, but I do want to talk about why this is important for California. As you can see in this chart here, we can see that federal dollars are expected to make up over 1/3 of the 2025-26 state budget. That's over 170 billion in federal funds to support critical public services and systems. Next slide. When we take a look at Medi-Cal specifically, we could see that nearly 2/3 of Medi-Cal funding comes from the federal government. And so cuts to federal funding could profoundly impact the nearly 15 million Californians who are enrolled in this program, with many, as we just seen, potentially losing their coverage altogether. And we want state leaders to not look to cuts to Medi-Cal as a first response. We want these cuts to be a last resort. State leaders should really try to identify new sustainable sources of revenue to help safeguard access to healthcare services. And as I wrap up, I do want to mention a couple of additional resources that are available on our website. You can check our website out at calbudgetcenter.org. We have a lot of resources both on the state budget and federal policy changes. And we have a webpage for federal policy changes specifically that I encourage you all to check out, as well as our comprehensive overview of the May Revise, which includes an overview of education proposal, housing homelessness, economic security, and so much more. And on that point, we have our own separate May Revise webinar happening tomorrow, where we will be talking about healthcare, but we're also going to be talking about other proposals in the May Revise. So please join us tomorrow at 1 p.m. You can sign up at our website. And with that, I will go ahead and pass it back to Bonnie. Thank you again.
Great, thank you, Adriana. Next, I'll turn it to Amanda to help us understand and make sense of what we just heard from both Anthony and Adriana, and really, bring it home for what does this mean in local communities? What does this mean for our state? So Amanda, it's all yours.
Great. Thank you, Bonnie. And thank you to Anthony and Adriana for laying out a lot of those impacts in very stark terms. Right now, actually, as we are speaking, hundreds of people are gathered in Orange County, embarking on a funeral procession to Representative Young Kim's office to highlight the thousands of Californians who would die preventable deaths if these cuts go through. Yesterday, similar actions took place in Bakersfield, and dozens of people there have been engaged in a week-long fast and hunger strike to highlight the cruelty of these cuts in putting the health of our communities on the line and really putting so many vulnerable Californians at risk because of these cuts. When you put it together with the actions in the governor's May Revise proposal, we could see potentially, as many as 4 million Californians lose their health care. And it's really a hollowing out of our Medi-Cal system that in the state we've worked so hard to expand over the last decade to make it more accessible, to bring more people into the program, and to make the program more robust in what it covers and how it supports communities. I think we'll talk a little bit later about some of the ways that Medi-Cal really has been the foundation for much of our social safety net throughout the state, for everything from housing to healthy foods to supporting families and schools. These cuts have ripple effects throughout the entirety of our safety net. So, I want to focus in a little bit for folks on the call on who is impacted by these cuts. 15 million Californians currently are on Medi-Cal. 50% of births here in the state, 55% of children, 2.3 million seniors are on Medi-Cal, 2 in 5 people with disabilities, and 1 in 5 working Californians. This touches everyone in our state in different ways. And the impacts of Medi-Cal and the potential impacts of cuts to Medi-Cal are not equally felt across the state either. They will hit low-income urban and rural communities hardest. And rural communities are especially vulnerable to the impacts of potential hospital and clinic closures. If your local hospital closes and you need to go to the next one 75 minutes away, it doesn't matter whether you have Medi-Cal or employer-sponsored insurance. That hospital is still 75 minutes away. Those are the types of things that lead to preventable deaths, that lead to worse outcomes that are really hard to measure, but we know how profound of an impact they'll have in our communities. And Medi-Cal is really important to the whole health of Californians. It covers preventative care, specialty care, emergency care, long-term care. It's the biggest payer of long-term care in the country. It covers substance use disorder treatment, which has enabled us to make so much progress in the fight against addiction and opioid deaths. Covers school-based care and so much more. And I think particularly, what we see when people don't have access to preventative care and to healthcare is that, rather than being able to treat and control chronic conditions like asthma, like diabetes, what we see is people wait until they're too sick to go to work, too sick to go to school, and they have to go to the emergency room. And this puts a strain on overburdened emergency departments. And it means that people are, living sicker, as Anthony said, and going back to a time when healthcare was only for you if you were rich, or only for you if you could afford it, and really takes us a step back from the progress that we've made here in California. We talked a little bit about economic impacts. Specifically here in California, 2/3 of net patient revenue for city and county hospitals comes from Medi-Cal, and 1/3 at investor-owned hospitals. So, every single hospital in the state will be impacted by these cuts. We could see reductions in services or closures as a result of these cuts. And again, these are not equally felt across the state. Those hospitals that can least afford to take a cut in revenue are the ones that are going to be most impacted by these cuts, and you're going to see the most dramatic cuts. 43% of our community health center revenue comes from Medi-Cal. These are, foundational in so many of our communities, providing wraparound support, and as important health hubs for communities throughout California. 43% of their funding is on the line with these Medi-Cal cuts. Medi-Cal also contributes $620 million to California schools. And California has more than 1.7 million healthcare jobs. And it's even more when you take into account IHSS jobs as well, which, as Adriana mentioned, are on the line not only from these cuts at the federal level, but also at the state level as well. This this program is something that has invested in our communities, has invested in our healthcare system, is the backbone of our healthcare system, and provides greater economic stability for the Californians who are on Medi-Cal. When Medi-Cal exists as a safety net, when you lose your job, you don't have to go without health coverage. When if you want to leave a job or a marriage, or however you're getting your health care, that Medi-Cal is there to make sure that you can meet your basic needs when you need it. And I think a longtime rallying cry of healthcare is a human right, and healthcare is for everyone. Medi-Cal is what has made that real here in California. And we are at tremendous risk on multiple fronts right now of going backwards, backing away from this light at the end of the tunnel of universal coverage that we have been so close to achieving here in California. Between federal and state cuts, more than 4 million people could lose their coverage. And the Center for American Progress estimates that 3,500 lives would be lost in California each year under just one provision of the devastating Republican proposal. And that's just under work requirements. That doesn't even take into account some of these other cuts. And and not only are these cuts unjust in the way and inequitable in the way that they will impact low-income urban communities and rural communities, as Anthony mentioned, they specifically target a number of vulnerable communities here in California, including targeting California specifically because of how we have worked to break down barriers based on immigration status in our healthcare system. This is something that the state has invested in and leads the nation in making Medi-Cal the strongest and most inclusive public health program in the country. And the federal government wants to punish us for doing that. It also specifically targets gender-affirming care and Planned Parenthood, just deepening the cruelty of these cuts. And I think, the last thing I'll say is, a lot of the language that we are seeing at the federal level and at the state level is very similar right now. In both places, we are seeing politicians talk about finding savings in order to, pay for something else or address deficits. In both cases, they're talking about protecting care for the most vulnerable. But at the end of the day, these are cuts. The savings come from people losing their health care. The savings come from people, getting disenrolled from Medi-Cal and being unable to re-enroll in the case of the cuts in California. They come from, people losing their job and then losing their health care, taking us back to that time with these paperwork requirements in DC. And it is a shame after all of the work that California has done, over the past decade to make Medi-Cal the robust program that it is, to see these similar talking points echoed in California, as we're seeing in DC at this crucial moment in time when our healthcare and immigrant communities are under attack. Talking about kicking people off of healthcare as savings is unconscionable, and I think it's something that many of us are speaking out against, that thousands of Californians are speaking out against. And talking about the value of these programs and the importance of protecting them and continuing to invest in them, especially when times are hard, especially when our healthcare is on the line.
Thank you, Amanda, and I'll invite you to stay and ask Anthony and Adriana to rejoin me for a quick, I think, discussion. There's a lot you all shared, and thank you all, both panelists as well as attendees too. There was a lot shared, and I'm seeing a lot of resources also being popped into the chat as well, which we will follow up with later on. But just wanted to slow down for a minute and maybe offer a couple places to dig a little deeper, maybe share a little bit more. And some of this, as we shared early on, comes from questions we received in advance of this webinar, what's on the top of mind of people. And the first is just I'll stop and give an opportunity if there's any place you all want to go a little deeper around what some of both the healthcare impacts are. I think we heard some of those, as well as impacts around what we'll call health related social needs, housing and food. There were a couple of questions around how does what's happening with the federal and state budget impact or not CalAIM. So just thought I would sort of stop and let you all fill in a little more if there's anything you want to highlight that speaks to both kind of the healthcare impacts as well as, health related social needs.
Anthony, do you want to start? Okay, I can start, but I will look to my colleagues to add as well. I think the ways in which California has worked to make Medi-Cal as robust as possible, the optional benefits, the expansions, CalAIM, housing supports, these are the things that are on the line. There are only 3 places to get savings when you have to cut Medicaid. It's enrollment, so how many people have access to healthcare, to Medi-Cal, benefits, things like housing, things like dental coverage, things like Adriana talked about the GLP-1s, right, and its provider rates, and or how much we're paying to our healthcare system, and when the state is looking at how do we balance our budget, when how do we absorb the cuts from the federal government, they're going to be making very difficult decisions about which of these things to cut if they don't take Adriana's recommendation to find new revenues. But that's what we're talking about. They're going to look at these things, and I think especially vulnerable are the places that the state has gone, has offered optional benefits, things that are not required in the federal Medicaid system, things that have been done to address the social determinants of health and kind of this wraparound care, I think are especially vulnerable right now in the wake of some of these cuts. In addition, and this is in addition to people losing their health care too. That's going to happen. There is, if these cuts go through, we're looking to see if there are things that the state can do to minimize the harms of those cuts. But people will lose healthcare, and the state will have to look at what are other ways that they can save money in the Medi-Cal program.
Yeah, I couldn't have said it better myself. I think people now know why I'm so proud of Amanda for her continued leadership of health access after 8 years working with her, and frankly also of why I'm also proud of being on the board of the California Budget and Policy Center and the work of Chris and Adriana. I would just say that, just to put a fine point in it, right? If they institute mandatory work reporting requirements, that's going to be particularly felt by the vulnerable communities that are in CalAIM, folks that are maybe low English proficient, people who are in homeless situations, people who are trying to deal with substance abuse or other types of issues, where Medicaid is actually the path to get them to a place where they can enter the workforce. But the bureaucratic barriers, even if they fall into an exemption, proving the exemption will make them fall off of coverage. And so they won't have access to any of the coverage, whether it is the main primary preventative care or the housing supports and other things that CalAIM hopefully provides. Then the double whammy is that you have these massive cuts to Medicaid and that the state's going to have to figure out. And basically, our policymakers will have to basically look at everything that's not nailed down. And that means the augmentations to mental health, the augmentations, the community supports in CalAIM. But frankly, it means everything else from the stuff that California cut a decade ago, like vision and dental and podiatry and psychology, and eligibility for seniors or immigrants or other populations or anything else. So it's unfortunately a 1-2-3 punch to our Medi-Cal program. And then, of course, this is in the context of if we're going into a recession where we were already going to have to be facing some of the things that, again, the state is already proposing, in the budget process. So it is, the final thing I'll simply say is that the Trump administration is also, through an administrative lens, looking to clamp down on efforts to use Medicaid dollars for what they social determinants of health, that they and so they had not done anything directly in terms of revoking waivers or things like that, but they're starting to put out guidance and signals that they may also go for administrative actions as well. So that's another thing that's outside of the context of this conversation on the budget reconciliation bill, but it's also something to be mindful of.
Yeah, and Amanda covered it really well in terms of the impacts on healthcare access and health-related social needs. I'll just add that it's great that state leaders have made these really bold commitments to addressing health-related social needs through initiatives like CalAIM. But I should mention that the proposed cuts in the May revise, alongside the threats at the federal level, could really undermine the promise of programs like CalAIM. And we didn't really talk about the other areas of the May revise, but there are also some concerning cuts or delays to food assistance and no new funding for homelessness, which also diminishes efforts to address health-related social needs through housing, food security, and other things like transportation. These needs are really central to CalAIM's goal of transforming Medi-Cal into a more equitable system, a more person-centered system. And also want to touch a little bit more on the point that Anthony just made about how these programs rely on federal waivers, federal support, federal approval. And while we haven't seen any actions in terms of rescinding or revoking the waivers or federal funding support, I do think that this puts into question the future of these really innovative initiatives to address health-related social needs.
Great, thank you all. And maybe continuing this, would love to open it back up to you all in different ways mentioned, ways we've been able here in California to really innovate and support different populations, different communities, and now some of those, innovations and advancements and really just support are also potentially threatened. Any sort of deeper discussion you'd want to have or share around particular populations or communities you all are concerned about?
I can start. I think, Health Access has been the co-chair of the Health for All campaign for about a decade with the California Immigrant Policy Center, and has worked tirelessly over those years to remove immigration-based barriers to accessing healthcare, making California the first state in the country to expand its Medicaid system to all income eligible people. The federal proposal targets California and about a dozen other states for having these policies in place. They are using Medicaid dollars as a weapon, weaponizing these dollars in order to try to coerce states into cutting their services for immigrant communities, to reinforce the cruel immigration policies of this administration. And, really just using this one big beautiful bill, which is what they're actually calling it, because we can't have nice things anymore. And in order to send a message to states that and send a message to all of us that they are doing everything they can to follow through on the cruelty of their rhetoric during the election with some of these actions. And I think seeing the state of California before we have even had any of those cuts take effect, also singling out immigrant communities and rolling back benefits and enrollment, and for folks who have benefited from the Health for All expansion. It is adding insult to injury in terms of attacks on immigrant communities here in California and in DC. So it's something that as the co-chairs of Health for All, we are certainly concerned about, and I'm looking for leadership from the state to continue to stand by the values that we set out when we expanded Health for All. Also, I saw a question in the comments about the cut to the LGBTQ and TGI funding that the state made. And I think again, with the threats happening in DC to gender affirming care, to trans communities, potentially the state could immediately shut down 68 programs that specifically work on health equity for our most vulnerable communities, including about 40 or so that are specifically working with LGBTQ and TGI health projects. And it's something that once again I think is walking back from the progress that we've made in trying to really take health equity seriously here in California, and address the needs of communities that have been underserved for.
Great, thanks, Amanda. Lots of great questions are popping up in the Q&A, and I've also seen within the chat too, and wanted to pause at this point. I am pleased that we are joined by a special guest from the governor's office. I wanted to welcome Richard Figueroa. Many of us know him as Fig, who's the Deputy Cabinet Secretary in the office of Governor Gavin Newsom. And just really wanted to, first of all, thank you, Fig, for joining us. We know you bring deep expertise in budget, state budget, and health policy, as well as philanthropy. You're a friend to many of us. Just wanted to give you this moment to open it up and really hear what's going on in your world, and especially as you've been listening to this conversation, and really what lies ahead. So I will welcome you and turn it over to you.
Great, thanks very much, and I appreciate the words of the other panelists as well. Just a few things from maybe the governor's office perspective, and there has been a lot of comments about what the May revision is. What the May revision proposals are. Obviously, this is the governor's suggestions about how to balance a new $16 billion funding deficit that we didn't know we were going to have. A lot of it because of changes, mostly because of changes at the federal level, and understand that this is an ongoing conversation with the legislature to kind of get to an agreement on how to work through those numbers. But as it's been pointed out multiple times on this call already, about what we're facing at the federal level, I think one or more of the panelists indicated or referenced some governor's statement yesterday about kind of what's at stake for California at the federal level. It's tens of billions of federal dollars associated, primarily with enrollment that would be at risk due to, at a minimum, the imposition of work requirements for Medicaid for millions of persons that currently are served by the Medi-Cal program, as well as, we didn't talk about this as much, adding a second eligibility redetermination to what is now just once a year, to make it twice a year. But in some ways, that's the tip of the iceberg in some ways. As was mentioned earlier, it would also dramatically, both freeze our current rates of provider fees, and we have a hospital quality assurance fee. We have the MCO tax or managed care organization tax. We have a fee that we assess on nursing homes. We have a fee that helps fund ground emergency transportation. Most, I think 49 out of 50 states use some sorts of provider fees. So the proposal not only freezes at the current rates where we are, but also would change the way that in the future we would be able to draw down those federal dollars by dramatically changing the formula. That would very, very radically restrict what we are currently bringing in right now through those things. And one thing I would put out to this group is that while those changes are proposed in the budget reconciliation bill that Anthony was mentioning earlier that they're discussing today, the Trump administration just proposed regulations that do the same thing within the last couple of weeks. And those regulations, unlike the federal bill, would make changes immediately in the way that we can calculate fees versus the ability to have some kind of off-ramp or transition process that's allowed for under the Federal Budget Reconciliation Act. So when someone here was even in the chat or somewhere asking, hey, would any of this take effect immediately? If the new federal regulations go through, some of these changes on our managed care or different kinds of fees would take effect immediately and impact us immediately on the budget in the budget year, which is not even accounted for right now in the process. The other thing I would mention, this was mentioned earlier, that it just kind of flies in the face of decades of even conservatism at the federal level for the federal government to tell a state how it could spend its own money. And as was mentioned earlier, states would get a penalty if they provided state-only benefits that were kind of running through the Medicaid program or associated with the Medicaid program. That's about a $4.4 billion reduction in federal funds as a penalty. I would want to clarify something that was said a little bit earlier. I think the reference was it would affect about 10 states. The bill changed last night at some point yesterday to now impact over 30 states because they've changed the populations for which you'd be penalized to even include populations that are legally residing in the United States, for which we were able to pull down federal dollars. So our view of what they called the technical change yesterday now brings in 30 states to which that penalty would apply, further endangering the even greater populations if states decide that we can't pay the penalty and would rather disenroll these individuals. I think, as mentioned before, there's a mention before about the attack on everything but name Planned Parenthood, and it would make it very difficult for them to be maintained as a Medicaid provider anywhere in the country. Interestingly enough, the CBO analysis of that provision was the only one that said it would actually cost money because you'd have lots of unintended pregnancies and lots of healthcare costs coming out of individuals lacking access to greater family planning and other services. I also don't want to forget CalFresh. And I know that was kind of in one or more of the comments here as well. It would cut federal funding for SNAP, which we call CalFresh in California, by somewhere between $2.3 and $4.9 billion. annually. And much like the work requirement in Medicaid, they're talking about, it would primarily reduce eligibility, again, for working adults. There seems to be kind of a theme or value proposition that we are seeing in the federal discussion, that adults don't deserve or should have very limited access to the same benefits that maybe aged, blind, disabled, and children would otherwise receive in terms of federal assistance. We obviously don't agree with that that value proposition, and think it's very inappropriate. But there's certainly a kind of a theme here that somehow covering adults or providing certain services to adults that again are not age, blind, disabled, or to children is waste somehow, or fraud, or abuse of the system. The other thing I would say about CalFresh is beyond just the changes. About $1 billion of that is in changes in terms of maybe 700 million in terms of eligibility. We're losing all of our nutrition education dollars across the country, and then for the first time, there's a cost shift to states to pay for 5% of the food benefit cost, which has never happened before. This has always been a federal program. It would shift a 5% cost to all states. And then if you have an error rate of more than 5%, and 49 states do, depending on that error rate, you might end up paying up to 25% of the cost of food benefits. And that would be billions of dollars for California. And they are either that's when your benefit level is either determined too high or too low when they've gone back to look at it. And again, only 49 of the 50 states have an error rate higher than 5%. And so again, this is billions of dollars or more federal funding loss to California. It also limits future increases in the Thrifty Food Plan, which is like sets the amount for CalFresh benefits. So it would change the way that they can calculate that in a way to limit future benefit rate increase or benefit increases on the CalFresh side. So all of these things are not accounted for in our budget. We are very, very concerned, obviously, about what all these things could mean to us, and through our own mechanisms and have been trying to provide the kind of data that would help educate the broader population about the importance of Medicaid to our overall. I think it was Amanda or others talked about not just to the Medicaid population, but in some counties, as you know, 50-60% of the entire population have Medicaid as their primary source of coverage. And so when you're looking at those kind of numbers, you are facing degradation of not just the potential clinical aspects of a person's health, but the overall health and wellness of the entire community when you kind of because you're working besides people, kids are going to school together, et cetera. So these are things that are obviously very concerning for the governor, and that the budget so far doesn't even attempt to deal with. And as Anthony mentioned earlier and others, there's only so many levers. Medi-Cal has always been a three-legged stool. I should also mention one other thing, and that is it's also, right now hospitals and primarily hospitals use another federal mechanism to draw down federal dollars to get directed payments, as they are called. That would be drastically limited or limited as well. And so lots of mechanisms that are outside the general fund even would be impacted, that overall help kind of sustain our overall safety net, as was mentioned earlier, would very negatively impact particularly our small and rural hospitals. So there's just a very long series of these things, and as multiple people have indicated, California has been a particular target of all of these different elements of this federal proposal. So very, very difficult times ahead. Again, as others have mentioned, we'll see what the U.S. Senate does with this, but certainly a series of almost unbelievable reductions in terms of the tens of billions potentially of federal dollars that are not going to be easily made up at all in California. If you lose these federal dollars, and might be looking at, gee, what can we do to make up tens of billions of federal dollars in terms of otherwise how to make up to the losses through rate increases or other kind of mechanisms. It's really hard to think about how we might be able to sustain such a thing over even a shorter or even longer period of time. So again, very dire set of circumstances, and that's again on top of California, because we are a border state, because we have ports, because we are a large tourism destination, all the many things that are impacting California's economy generally, without even taking into account some of these additional potential federal reductions of funding in the potentially tens of billions of dollars. So I mean, that's what obviously we're very concerned about, and as all the folks on this call watching very carefully to see what the House does, and again, obviously hoping for some changes in the Senate that would mitigate or eliminate most of these potential reductions. Back to you, folks.
Great, thank you, Fig.
Are you sure it's thank you, Bonnie? It's like, oh my goodness. So yeah, it's pretty dire in some ways, just kind of looking at what they're trying to do to us. So
Yeah, someone just posted, may the force continue to be with you. So yes. I would love for the panelists to join us. This time has gone very quickly, and we're very rapidly coming to the close. For those of you who haven't been monitoring, though, there is very robust Q&A and even answers to many of the questions that's happening in the Q&A box. So please check that out. We are collecting these, and we'll figure out how to include these as part of the post-webinar resources. But just in the remaining couple minutes that we have, because I did see several questions kind of related to a reminder of maybe what the next steps are. So Anthony, if you could lay out the next sequence of steps, and either Adriana or Amanda, kind of, timelines, time horizons that you talked about, that maybe just we could recap in the final minutes that we have.
Yeah, on the federal level, I'll let my California colleagues talk about the state budget process. But obviously, the House Rules Committee is still going on. But they are trying to see if they can have a vote as early as this evening. Their real goal is to try to pass it before the Memorial Day recess this weekend. But Speaker Johnson has said that he would even keep the House in for a day or a couple of days until they get it done. And we'll see if the folks who are holding out, whether on the hardline right, who actually want to make this bill worse, who want to cut off more people more quickly, have their way with additional amendments, or whether, or some of the other related issues on state and local tax exemptions, or electronic vehicle tax credits, or other things, stall the bill further. If it does pass the House, there needs to be a Senate process. It is looking likely that the Senate is not going to go through its own markup of going through committees, that it would work off of the House bill, but make its own changes. And so there will be a continued opportunity for people to tell their story, for people to tell the statistics of what's impact, for the analysis to come actually out of what are the impacts and the redounding impacts of these different impacts. And so this is not over. It's not over today. It's not over tomorrow. It's not over this week. It's not over the next month. And again, the more that we can push this off and delay it, the more that the cracks of their coalition become more severe. One day longer, one day stronger, as some of our labor friends say. And then obviously it has to be whatever the Senate does has to be reconciled with the House. They want to get it done by July 4th. Their real deadline is probably in September. So that's the process. And then the final thing I just simply want to say is none of this is necessary. That this is all to fund tax cuts that go to the wealthiest and to corporate interests. A CBO analysis just came out last night that showed that the distributional impacts of this is that this actually takes away income from the lowest 10% through its healthcare, through food assistance, through other things, and it actually shifts and transfers those dollars to the top 10%. In terms of tax cuts. So this is not to reduce the deficit. This package overall actually increases the deficit by not billions or hundreds of billions, but by trillions of dollars. So this is not necessary. They do not have to do this. If they want to go after waste, fraud, and abuse, that's a very different bill, and we have tons of ideas on that. but but those are some of the messages, which are the real impacts on coverage, on costs, on care, and that there's another way to either find the savings for what they want to do, and frankly, should they even be really transferring dollars from the poorest to the richest? Thank you.
Anthony, you covered it super well on the federal side of things. I'll talk a little bit about the state budget. I know there was a question in the chat about that as well. Just want to mention that right now, Assembly and Senate budget subcommittees are convening to review the governor's May revision proposals, and policymakers, as well as members of the public, have a chance to weigh in on these proposals and have been doing so already. A few weeks from now, Assembly and Senate leaders are going to reach a deal on a unified legislative version of the budget package, and then the legislature begins drafting the initial budget bill, also known as the Budget Act. And then they'll move towards finalizing the Budget Act for floor votes. That can take roughly anywhere between like a week to 2 weeks or so. By June 15th, the legislature is going to pass the Budget Act. That's the constitutional deadline. And then around the second half of June, the governor and the legislative leaders are going to continue negotiating in order to reach a deal on the budget package for the upcoming fiscal year. And then we'll also expect to see the governor sign the Budget Act and any sort of budget bill juniors and trailer bills after that. I also want to mention that if the worst were to happen at the federal level and we were to see the congressional Republicans advance a really harmful budget proposal after we reach a state budget deal, then legislators are going to have to come back for a special session, and there will be other opportunities to influence California's response. So for advocates and members of the public who are really interested in making sure that state leaders respond in a way that doesn't harm the most vulnerable communities in our state, there will be opportunities to continue to do that important advocacy work.
Great, thank you. And really just want to appreciate everyone who joined us. So Brenda, Fig, Adriana, Anthony, and Amanda. Just thank you again for first and foremost your time, for your insights. And also I'll want to thank the attendees in today's webinar. We know that policy decisions made in legislative chambers in both the state and national level can feel far removed from daily life, but they deeply impact our ability to build healthy and thriving communities. The California Endowment remains committed to working alongside our partners, community organizations and advocates and public institutions to advance health equity across the state. As a reminder, a recording of this webinar and related materials will be shared with all registrants shortly. We'd also love to hear your feedback on today's webinar. Please take a moment to fill out the survey link in the chat or scan the QR code on your screen. Thank you again, and we hope to see you at the next Policy Perspectives webinar.